The Global Digital Health Summit, Expo and Innovation Awards 2023, held at the Geo World Convention Centre in Mumbai, brought together pioneers focused on transforming healthcare in India and planning for large-scale adoption of digital health across the healthcare value chain. The summit focused on technology adoption amongst doctors, small hospitals and the pharmaceutical industry. The summit discussed the adoption of digital health across medical specialties, generative AI, robotics and other emerging technologies.
We would like to start this summit with a quote by George Merck. We try never to forget that medicine is for the people. It is not for profits. The profits follow, and if we have remembered that, they have never failed to appear.
The summit was inaugurated by the Honourable Minister of Commerce and Industry, Consumer Affairs and Food and Public Distribution and Textiles, Government of India, Shri Piyush Goyal.
India's doctors are ready to serve humanity worldwide. Digital health initiatives can make that possible. This summit will give you a glimpse of the progress India has made in digitalization of healthcare in line with Prime Minister Modi's vision. In India, we are following a holistic and inclusive approach, providing affordable healthcare to all. Under India's G20 leadership, Global Initiative on Digital Health has been established in partnership with the World Health Organization to foster collaboration among nations and organizations to realize this transformative vision. I want to reiterate the clarion call given by our Prime Minister Shri Narendra Modi at the recent G20 Health Ministers meeting. And I quote, "Let us open our innovations for public good. Let us avoid duplication of funding. Let us facilitate equitable availability of technology."
If you are not in digital health, we are not into healthcare. Together, medical science and technology will create healthcare, but either of them is just sick care. And that is what we have been grappling with for the last couple of decades. Technology does not change anything. It is the people who use technology change.
We can make India the star of the world, and we are poised to do that. And this is an incredible opportunity for all of us to make sure that this future is realized in a very, very pragmatic way.
Because of a highly digitalized world, patient is driving all of us now and saying that, look, first thing I want is I want to take care of my own health. The second thing the patient is demanding is, I want to participate in everything that you decide. Probably this is the biggest ask that we can have through this summit, is to ensure that we all now catch up with the patient and ensure that the patient gets what he or she deserves.
The first session of the summit, hosted by the International Patients Union, focused on patients as partners in digital health and understanding the expectations of patients.
I would like to call to the podium our first esteemed speaker, Ms. Vandana Gupta, has played a key role in mainstreaming cancer care. She will be talking about cancer in the digital age.
It's really very nice to see that the patients have been invited even before the other speakers, because that gives us a chance to make you hear what we would like to say. Some of the general expectations include the need to be listened to, the need to receive clear explanations and instructions about their condition. We've often seen that results and trials are designed without taking the input from patient and the committee. The development of digital technology in health is a powerful lever for improving care and services, but it also brings risk for certain users in vulnerable situations. To foster responsible and optimal innovation, use of digital health by all, including vulnerable groups, we propose that patient and citizen engagement must be an essential component of the research strategy.
We have tools to fight TB, cure TB, end TB, prevent TB, eliminate TB. But why is still tuberculosis is spreading, affecting millions. We have to think about person-centric approach. Today's digital era, there is a solution, there is innovation. Think about beyond the data. Use AI.
The Chief Health Officer Google, Dr. Karen DeSalvo, focused on how Google was formulating strategies to bring health into their products.
We at Google are a part of people's lives every day already, helping them make decisions about where to go.
The Drug Controller General of India, Rajiv Raghuvanshi, and Bakul Patel spoke on the future of medical devices, software versus hardware, the evolution of the pharmaceutical industry in the digital age, and the role of big data, AI, automation, and robotics.
I get amazed when I start thinking that what all is going to happen with the software getting integrated with the healthcare. The software-driven activities will become indispensable, and this is a known fact. If we have to reach to the last mile with the programs of the government, it cannot happen without proper software infrastructure getting created and bringing people participating in all this. This is a phase where both the healthcare giver and the receiver, still they have to change that mindset of moving away from physical contact with doctor to the software-driven healthcare systems. Government cannot do it alone. A lot of initiatives have to come from people sitting here. Maybe some social entrepreneurship to increase the literacy at the level of the population where the cultural shift has to happen. Indian pharmacopoeia is being converted into digital as I talk, and next 6 to 9 months, we should have a digital IP in hand. Top 300 brands of this country now compulsorily will have to have a QR code on each pack. So, spurious thing we are trying to address through this digital technology.
Medical devices are predefined for a very long time in terms of anything that cures, treats, mitigates disease or prevents disease or condition in humans. So software can obviously do that, and we see more and more of this sort of happen in the space. Sensors and actuators that were only made for medical devices in the past are becoming commodities. And the flip is happening as well, where sensors that were used in consumer technologies are now entering the space of medicine. What's making those things act, or what making those things capture data, is pretty much software only. It not only sort of created this space for people to start thinking about why software becomes more important, but also started to sort of ask us challenges around why and how we should start regulating this in the most practical way to not only sort of regulate so that innovation doesn't happen, but regulate in a way so that innovation can happen, as opposed, and still maintain the standards of safety and effectiveness. And with the advent of generative AI, in the last 10 months itself has sort of shown that information that exists today and which is in abundance needs to be transformed into something understandable by humans. And that's why you are seeing a lot more activity around the space.
Namaskar. I am Wolfie Bott and I represent...
This was the first digital health summit in the world with a robot as a panelist who answered questions from the experts in digital health.
Question number 1. What role you believe AI-driven tech and robotics can play in smart hospital care and patient experience?
The exciting journey of we, AI and robots have started in smart healthcare. I and my fellow robots take several roles within healthcare as a patient buddy, front office registration, vitals check, patient room navigation, engagement, or remote ICU management. This collectively helps to enhance and have consistent patient experience.
The CEO of American Telemedicine Association, Ms. Anne Mond Johnson, and the Director of the Department of Digital Health and Innovation, World Health Organization, Alan Laberique, addressed the summit.
My professional work has always been driven by my belief that everyone should have access to good health care. Citizens can and should be equipped to do the right things for themselves and their families. It is essential, and it is a part of our movement. When I joined the ATA 5 years ago, telehealth had been available for at least 25 years, but its use by citizens and clinicians was very low. Today, our why is this. We're here to ensure that everyone has access to health care where and when they need it, and that when they do access services, they know it is safe, effective, and appropriate, while enabling clinicians to do more good for more people. In India, you more or less skip the PC world and went straight to smartphones. You can more easily overcome infrastructure challenges and leapfrog straight stages of traditional development. You're comfortable with transacting business on smartphones, including payments. That's something that we have not reached at your scale. But you're a country that operates at enormous scale, at great advantage. The other advantage you have is that you have magnificent healthcare facilities, but it's not the backbone of your system. You're able to elevate the role of local clinics and local health aides with telemedicine support, and you can address the shortage of specialists, enabling consultations across vast distances. You are more resourceful and innovative with lower capital, and you have a population that has more faith in the government and in institutions. So when should you start your health journey? Immediately.
We find ourselves in a world that has changed. These last 4 years have not only kept us apart, isolated and scrambling to respond to a pandemic, but have taught us many lessons. So I would say we are at a digital inflection point, one that we at WHO, as a member state organization, feel every day. Could we stem the tide of senseless maternal and child deaths through the application of digital interventions? Could we develop digital systems able to support women delivering largely unassisted at home, disconnected from healthcare? Could we support overwhelmed frontline health workers who struggle to deliver services across vast rural areas of these countries with minimum incentives or technology at their disposal? WHO has, for more than 20 years, sought to put governments in the driver's seat, developing clear plans, strategies, and technical expertise to invest in digital solutions as part of a broader health system strategy.
Renowned cardiac surgeon Dr. Devi Shetty talked about the digital health strategy for hospitals.
I believe that India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. India will bring about this massive shift in a short period of time because of the ongoing two major shifts which will happen. Digitization of healthcare, and the second one is universal health insurance. Smart software will soon make smarter diagnosis than doctors. In the hospitals of the future, people who are going to touch the patient are the only ones who are going to be in the hospital. World's largest healthcare provider will have no beds. It is going to be a software. And I strongly believe that India is going to build that most advanced software which will transform the healthcare of the world.
The summit saw discussions on how startups are driving disruptions in healthcare in India.
Our days, there was no possibility of meeting, interacting, getting mutually enlightened. Fortunately today, every city has got opportunities for the region to get together, understand what am I, where I want to be, why I can't do that. These type of things can be learnt mutually. Scale is very important. And let me tell the punchline. Scale nahi to kale nahi. If you have to truly have a leadership position, you need to scale up. And scale gets you volume. Volume gets you three unique powers. First is purchase power. You can purchase dictating terms with vendors. Second is pricing power. The leader only decides the price. The others have to follow. So purchase power, pricing power. The third one is people power. You will get the best of the people in the industry joining with the leader. So you have to scale up, and scaling up has to be done in appropriate time. Create a profitable business model and then scale. Don't scale loss-making businesses. You will collapse. Thank you very much.
For the first time at the summit, the stage featured the simultaneous presence of the presidents of three key medical associations of the region. The summit also witnessed masterclasses conducted by stalwarts of the industry. The summit also saw the Health Parliament Collab in collaboration with Google Health as they presented the Open Health Stack Developer Workshop. The Global Digital Health Summit Expo featured the latest and most innovative digital health products, services and solutions from around the world with the launch of the DTX Alliance.
I really hope the enthusiasm continues for our Asia-Pacific Digital Therapeutics Leadership Alliance, and I would request all of you that it's high time we should come together and let's work together for this initiative. Thank you so much.
The Digital Doctors Leadership Maturity Model and the launch of Mission Scale.
So this model is built in a way that if you just move up the value chain, your technology adoption goes up, so your clinical outcomes go up, and eventually what it culminates into: trust because of technology, respect because of outcomes. And the whole idea is that doctors should know that if I'm using technology, what is going to be the technological adoption at a level and what's the clinical outcomes that I can correlate to.
Honorable Prime Minister Shri Narendra Modi's leadership has turned India into the world's third largest startup ecosystem. Mission Scale will further benefit India's startup ecosystem, enabling it to accelerate growth and leverage it to strengthen the vision of a developed India.
The course on Executive Leadership Program for Founders and CEOs, Transforming Small to Smart Hospitals.
This course will cover all the practical aspects of how to drive growth and sustainability in a small healthcare organization and address the challenges faced by small healthcare organizations.
The launch of the campaigns Neither Share Nor Learn and Feel Something, Do Something.
We should launch a campaign that if you feel something, do something about it. Don't wish it away. Go to a doctor. Talk to them. Do feel something, do something. Let's spread the words. Let's have campaigns. And I thank our team at Health Parliament and Patients Union to come together to curate this campaign.
We are proud to introduce the Neither Share Nor Learn campaign, a worldwide movement aimed at combating the harmful effects of false information on our well-being. We all need to be responsible in the information that we share.
And the launch of Smart Clinician Suite and Smart Hospital Suite.
We have put together a structured way to adopting technology relevant, once clinically validated, for doctors and hospitals.
These initiatives are essential part of making it acceptable by the masses, creating these kind of platforms where we connect more and more people, more and more organizations, more and more nations, is basically the inherent need of the whole system.
The platform also saw the celebration of innovations and advancements in the field of digital health with special jury awards and innovation awards.
Sometimes we tend to forget that the center of any issue related to healthcare should be the patient. And many a times in the jargon of various technologies and various medical terms, we tend to forget this centrality. I must congratulate the organizers of this conclave for keeping this centrality intact. And therefore, right from the first session, we have seen that the centrality of a patient care has been maintained till the end. If you still don't implement digital health, you will be doing a disservice to healthcare. This is the message, and we all should take our responsibility and play a pivotal role in using the digital technology in the more efficient, cost-effective, and also effective treatment to the disease.
Digital health is about great results in medicine. These 2 days of knowledge will take 2 months to assimilate. At Digital Health Associates, at Health Parliament, at Digital Health Academy, at International Patients Union, we would like to thank each of our sponsors and supporters to come over to Mumbai and be with us. We encourage to do more and promise that next year it will be much bigger. Thank you so much.
This Global Health Summit is an excellent platform to have a cross-fertilization of all sectors related to digital health space in every digital domain which you can think of. And I'm certain that healthcare needs digital space, and integrating healthcare in digital space is work in progress. And I think this conference and all the partners are ensuring that we can make lives of people better.
I've never been to a conference, an event, a digital health event that opens with the focus on the patient. In the midst of all this digital health innovation, sometimes we lose sight of what's most important, and that is the experience of the patient, the consumer.
A Global Digital Health Summit is a pivotal gathering of minds. Those are dedicated towards future of healthcare. This summit is acting as a beacon and illuminating a path towards a better, connected, and healthier world.
Let's get everybody on stage and have a group photo.